Hello, my name is Angela Rose, and I am going to speak with you today about adults without health insurance in Dallas County and Texas. Let's explore the disparities in life expectancy between North and South Dallas, examining the impact of the lack of health insurance perpetuating this division. Residents in these zip codes, which are only a few miles apart, experience vastly different health outcomes with significantly shorter lifespans in South Dallas. In 2021, 43% of individuals in the 75217 zip code lacked health insurance, almost 4 times the U.S. average and nearly double that of Dallas County. Health insurance significantly reduces mortality rates by providing access to medical care and preventive services. This survey shows roughly 40% of adults have inadequate insurance. Delving into the factors contributing to these inequalities, particularly the barriers to health insurance access, sheds light on the urgent need to address systemic inequities and advocate for health equity for all Dallas residents. To offer reduced cost health care at the county level, addressing the impact of poverty on health insurance coverage is crucial. This can be achieved through collaborations with local healthcare providers, offering discounted services, partnering with nonprofits, and establishing mobile clinics. Adults living below the poverty line often face barriers in obtaining health insurance, limiting their access to health care, timely treatment, and preventive care, leading to poor health outcomes and decreased lifespans. Approximately 25% of the residents in this zip code live below the poverty level. This gap in health coverage stems from various issues, including socioeconomic needs and a lack of understanding about program applications. Many fall into this gap due to Texas's decision not to expand Medicaid. This graphic has astounding numbers about Medicaid in Texas. Millions of uninsured residents have limited access to affordable health care in Texas, which emphasizes the need to expand coverage, reduce costs, and address access disparities to enhance health outcomes and reduce inequities for current and future generations. High rates of uninsured Texans underscore nurse practitioners' crucial role in expanding healthcare access by advocating for policies promoting affordable healthcare, delivering health education and preventive care in underserved communities, and collaborating with healthcare teams to ensure individuals receive necessary care. APRNs in Texas play a vital role in improving healthcare access for underserved populations by collaborating with other providers to establish healthcare centers or mobile clinics, like the one shown here, to provide essential care services directly to those in need. Texas has the highest rate of uninsured individuals in the nation by a significant margin, prompting the U.S. Census to extend the range of this chart for comparison purposes. This alarming statistic does not account for the 1.2 million people who have lost Medicaid coverage since this survey data was published. Dallas County is in the bottom quartile of Texas counties for adults without health insurance, with a rate of 24.4%. Despite marginal improvements from previous years, this signifies a significant lack of access to health insurance, more than double the national average of 10.8%. Texans without health insurance and limited access to affordable health care are at grave risk of health challenges. It is important to prioritize increased health education and preventive care for this vulnerable group. Ensuring access to health care is a basic right that must be a top priority to safeguard the community's health. To adequately address these issues, a comprehensive approach is needed. Implementing community health initiatives and increasing funding for local healthcare programs can help bridge the coverage gap and ensure that all residents have access to quality healthcare services, regardless of their insurance status. The current approach is failing due to limited resources and systemic barriers that prevent uninsured individuals from receiving necessary care. Expansion of local medical services to provide access to low-cost health care can save lives and improve overall health. Other communities facing similar challenges have implemented innovative solutions such as in-school community health centers, mobile clinics, and partnerships with local hospitals and healthcare providers. These initiatives have successfully increased access to care, improved health outcomes, and reduced healthcare disparities for citizens. By learning from and adopting successful strategies from other communities, Dallas can better address the healthcare needs of its uninsured population, ensuring better health outcomes for all residents. This is an image from the Hope Clinic in Houston, a community health clinic accessible to everyone regardless of insurance status. Policy recommendations for addressing the lack of access to affordable health care for uninsured Texans would include increasing funding for community health centers and mobile clinics to improve access to primary care in underserved areas and providing incentives for healthcare providers to offer discounted or sliding scale fees. This slide showcases local support for our community by sponsoring health initiatives like community health fairs. These events help provide essential healthcare services directly to underserved individuals without insurance, ensuring equitable access to care for all community members. Patients are dying in emergency department waiting rooms. We must implement measures to ensure that all Texans have access to necessary healthcare services. By investing in preventative care and early intervention, we can improve health outcomes, reduce healthcare costs, and create a healthier and more resilient community. Urgent action is needed to fund community health centers and incentivize providers to reduce healthcare disparities and improve access to quality care. Prioritizing preventative care will benefit individuals and cut costs. Let's work together to ensure that all Texans have the care they need for a healthy life. My contact information is included on this slide. Please feel free to reach out to me if you have any questions. Thank you.